And as a medical person, I was always trained it has to go for cesarean section. But having not had any functional linkages, any kind of backup like that, they have handled complications to a sophisticated level, which we have been documenting in the project we started. We got in our pilot project, and we will be documenting in depth to the extent we can and to the extent that is ethical. The guy's understandings of the body is totally different from a biomedical understanding. It's an understanding which, in tune with the other indigenous Indian systems like Ayurveda or Karnataka Siddha, Yoga, it's energy-based rather than based on matter. Of course, they're dealing with matter, and they know very well they're dealing with matter, but their understanding is of energy flows and passages of energy, and that's something we are all very unfamiliar with grasping. And they have a close relationship, all of them, in all parts of India, I would dare to say. They have a close relationship with the deity of reproduction. In Jharkhand, they call her Soshtima, this Sarshti Mata. And in other parts of North and Central India, Bay Mata. In Maharashtra, Satbai. And in the area of Karnataka where we're going, she is called Gangama. And some other names. But that is an aspect which is just totally out of the public health, idea, and yet it affects people's health. I would like to say that, but how it affects, I can't say. We're trying to go into that with the research that we're embarking on. Just a few words for lack of time, to make more time for discussion. I won't go into detail, but usually the antenatal set of skills is not included in the DICE responsibilities nor their tradition. But DICE are looking very carefully often for weakness in the woman, for discoloration like jaundice. They very keenly know the shape of the abdomen, the way the woman is walking. Is she stumbling? Is she likely to be able to face labor and birth with strength and successfully? Assessing the fetal position, of course. There's even a test that the guys are doing which I have heard about as much as 30 years ago, but I never saw it until we got the guys to demonstrate recently. Standing a woman up, putting some oil on her navel, and watching the flow of the oil. And if the oil goes to the sides, it means the birth is delayed. I mean, it won't happen very soon. But if the oil flows down straight, it means that the birth will happen soon. And that means that the head actually has engaged and there is room for the oil to flow down. If the head is not engaged, it's happening. So they're paying attention to technical details which generally is not realized by the Western medical system, the system that presumes to train them, which doesn't even ask what they know or what they do. That was a diagnostic detail. They also look after the labor, and the whole first stage of labor, which sometimes is lengthy. They start with a tail malish, and at the same time as reassuring and calming the woman and giving her strength, giving her the himmat. They also very astutely look for the position of the baby, the position of the head, and if there's some kind of what they consider an adjustment to be made, they make that slightly. So there's not a very sharp distinction between diagnosis and their actions. They give a lot of importance to movement in labor. And if you know, in the hospital, usually it's like as soon as a woman comes into hospital, she's like immobilized. She's intravenous drip is started and she is supposed to be not moving around. Whereas the Raia and the whole family, this is shared knowledge, will keep the woman moving as much as she will. Not force her, but as much as she will. which is in contrast to the experience of women in hospitals. In the second stage of labor and then birth, there are a number of birthing positions. The main hallmark is semi-sitting, not lying down positions. Although the guys are not opposing lying down positions if the woman prefers it. They are even back-end positions, a particular kind of knee-chest back-end position for a breech baby has been described in detail. And of course they do things like removing the cord from around the neck. Fundal pressure is an area which varies. Some areas don't use very forced fundal pressure, but sometimes, some places it's very harsh, very strong, and perhaps unjustified. And here I want to bring in, I think, that the best place to discuss these issues of what's the skill set, what are the protocols, what are the limits, what are the standards. The only people to really decide that are the guys themselves when they debate all the benefits and the lack of benefit. Then there is after the birth. I left out the oil massage of the perineum and the kind of stretching of the perineum to avoid tears is another strong tradition of life which the government hospitals and the private hospitals don't pay attention to, except in some cases where the nurses may be coming from those traditions. I've seen nurses do oil massage of the perineum, but I think it comes from the Thai tradition itself. And then the birth of placenta, which is often called the third stage of labor, they have a whole number of traditions to hasten the placenta to come out, and they'll never cut the cord until the placenta is out and the baby is breathing, baby's color is good, baby is well, then only they will cut the cord. There's no hurry to cut the cord as you find in most hospitals. And scientific research has also now in the last decade or so has come up with 3 or 4 studies showing that there's a benefit to, say, delaying for 2 minutes in cutting the cord. There's a benefit to the baby. But this the guys have been doing since ages. Then, of course, the ritual where ultra life of the people of that family, of that baby, and it's something which again is outside the public health system, outside of hospital practice. In Bokaro, we found that after the burial of the placenta, it's the ritual to this Socio-Legal, this deity. They build a fire which they use for the next 6 days in the sekai, we call it, and tail bladder sekai of the abdomen. Before that, there's a repositioning of the womb, which sometimes is repeated during the postpartum practice also, where the womb that has been pressed down and it's moved upwards and it's contracted. And to me, in the places where this tradition of it's called Mata Sani or Matmani, it's in Bokaro. It seems to me that it must be helping in making a flaccid uterus contract so that the bleeding is controlled and stopped. And I think such a tradition, such a practice might even be saving women's lives from postpartum bleeding. It's not as if she just had the baby and she's left to bleed. Her abdomen is massaged and her uterus is actually replaced by a technique in which the guy uses her forehead and her head to press. She stands the woman up and she presses on 3 sides to move the womb up, and then they bind the womb. Nobody's ever done any research to see if any of these traditions have, what effects they would have. So just left was telling me that after the training, they have been encouraging this one role of the guy as friend, philosopher, and identity card in the Gujarat Dai Sangathan. They have encouraged the guys to make them usually work, according to Smita, who's worked with them. Now, the guys may be called for any postpartum problem in the mother or the newborn. And postpartum is acknowledged as a lacuna in the healthcare system, in the formal healthcare system. Postpartum receives the lowest priority, and yet in some ways it gets very, very high priority, the highest priority from the guys who depend on that for their livelihood. Most of the payment that the guys traditionally get is for the postpartum care. They consider the care they give during delivery as would they resent it when the local RMP doctor comes and gives an oxytocin injection and gets 1,000 rupees, and she may be just given a token 11 rupees or something for cutting the cord. They resent that, but they don't expect real remuneration for the birth itself. That's kind of their. For postpartum care, it's a very and then they have guys have ritual functions on certain days. These rituals are very connected with that goddess that at least in Jharkhand we observed it ourselves. And then at the marriage of that child, the guy has a special place often. And then they also help women with other problems, general minor illnesses, with herbal remedies, as well as products of the uterus, which is another very interesting practice which I want to learn. Traditionally, and even today where their practice is still strong, is reliable, affordable, acceptable, appropriate, and she